Good morning, OKN. 8:34. Happy Friday to you. You know, you're going to be going out and about. You're going to be doing some things. You might be going to a restaurant. You might go to a party. You might just go see some family or friends. You want to have that confidence about you.
Yeah.
And there's definitely some health things to it, too. Straight teeth and your teeth in general. You want to have good hygiene. You want to take care of your mouth. That's something that I think that's important. Am I allowed to say that you want to take care of your mouth, Dr. Gross? Is that something you want to tell people?
I hope you're telling people that. That's a great thing to tell people. I'm all on board for that.
Dr. Ryan Gross of Clearsmile Orthodontics. You can visit clearsmilecharlotte.com, clearsmilecharlotte.com. Multiple locations. Dr. Gross is at the Huntersville location right here in Birkdale Landing, exit 25. You doing all right?
Yeah, doing great. It's back to school time. We're seeing a lot of kids and teens wanting to get their teeth straightened before those big class photos, right? So an important time to see people and get their confidence up.
Can I say congratulations? Am I allowed to do that?
Yeah, sure.
Okay. Congratulations on getting engaged, by the way.
Thank you.
Very
That's
exciting.
awesome.
I appreciate that. Yeah,
Yes.
big weekend. It was super exciting. Got the surprise. That was the big thing, trying to keep it a surprise. I told her, hey, this is the only time I'm ever going to lie to you. It was the hardest thing I ever did. But it worked out great. So super excited.
Was she all smiles?
She was.
Oh.
She was. Yeah. Maybe a little bit of tears, mostly smiles, though.
There you go. You could bring tears and joy to people's lives because of straightening their teeth. That's something that people probably wonder, is it even possible? Like, as crooked as my teeth are, can I get them straight? Have you met a mouth that you can't straighten?
So far, no, I have not. No, we've been able to treat everything. And I'm going to show you some cases, actually, some befores and after to show you, because I think a lot of times people do come in, they're like, am I even fixable at this point? And usually the answer is yes. And sometimes they have to get, their teeth cleaned first, this or that. But I'll show you the before and afters, and it's going to be a lot of fun.
Okay, can we go through them? You've got some pictures. Bill's got the photos ready. If you on the live stream, the video live stream on the WSIC News app or on socials, or you're watching on demand, you can see this, right? So this is real. These are real mouths.
These are real mouths that I treated at the Huntersville location. Before is on the left, after on the right, and then the tooth smile, zoom in, top and bottom. So, this patient came in. It kind of looked like his chief concern was that he was missing a tooth, just that it was kind of far back. So you almost saw in the smiling shot, looks that way. And then after completely fix it, one of my dental colleagues did the bonding to make that tooth a little bit wider because it was kind of narrow once we brought it forward. But how long do you think this took before and after?
Oh gosh, we got to guess how long that took.
You got it. Take a stab.
I'm gonna say this is like a 2-year plus.
I'll say 8 months.
Okay, big range. 2 years is a great guess. This was 20 months, months, and it was with Invisalign.
This was Invisalign though. So I would think this would have to be traditional braces. Yeah, you could do this with Invisalign.
Exactly, yeah, and that's part of the thing too, is that we can do this with aligners.
And so Invisalign is basically where you guys make the molds of brace that kind of slip on and slip off. They're not permanently affixed to the person's teeth.
Exactly. We'll temporarily bond what are called attachments to teeth. They're like tooth-colored little buttons that the plastic of the aligner will hook onto for better anchorage. But this case was aligners, believe it or not.
Wow.
Can I also ask you another question? You said it's the tooth to the right or left. I don't know if it's stage left or stage right. What is that tooth called? Are there particular names for teeth?
Yeah, there are. So for this patient's, his left, that was it looked like a missing lateral incisor. But it was just towards his palate. So we had to push it forward and then bond it to get it symmetric with the right side.
So another win, another satisfied patient here, I would imagine.
Absolutely. You can see how happy he was in that after photo. He was great.
All right, so Mames is better at guessing how long it takes to straighten teeth. Let's see if I can. Okay, now I got calibration. I got a little calibration.
There's a prize on the line, guys.
We got prizes again.
Dr. Ryan always brings the prizes.
I know, right?
All right, number 2. What do you guys think?
How long it took to get this smile?
That's right.
This one looks tough.
This
There's
has
a lot
an
of
overbite,
crowding.
underbite as well?
Yeah.
Yes, you're right. So it's got a mix of overbite in the front, underbite at the canines. You can see those lower canines forward, crossbite in the back, bunch of crowding. Yeah.
I'm going to say 29 months.
Okay, or we're doing months. Okay, I'm going to say 18.
Wow, Mamie, you got it right on the nose. Believe it or not, 18 months is exactly
impressive.
right. Yeah.
Both for Mamie guessing and doing this in 18 months.
18 months.
And to be honest, Justin, I thought this would be a 24 to 30 month case, easy. And this was with aligners, believe it or not.
Wow.
So no braces at all.
So it's another opportunity here for Invisalign to be the solution for you.
Absolutely.
Because you would think that Invisalign, right, you can only do so much with.
Yeah, I would think Invisalign was for just a little bit, just fixing a little bit of issues. I would think, I guess, and then maybe that's just my old school of having like the full metal mouth, the headgear when I was a kid too, and thinking like as bad as, teeth are, then that's the only option.
Did you have like the over the top around the back?
Oh yeah. I was cute. Glasses too. Big old glasses. Yeah, I was looking cute in 7th grade.
That's all. Bill, can you pull that picture up for us? No, I just
there are none left. They're all gone.
They're all.
Even my sweet mother, she was like, "Nah, you don't want these."
All right, so Mames 2 for 2 on these as compared to me. That's for sure. Okay. Oh, let's see this one.
That's awesome.
All right, Mames, you guess first this time.
I'll guess first this time. All right, so this looks like a big spacing here too. So.
Yep,
you got to correct the spacing.
Yeah,
pull a little bit forward, maybe shift a little bit.
I'm gonna go lower for this one. I'm gonna go 13 months on this one.
Ooh, getting it done quick. I'll take the over. I'll go 16 months.
Okay, Justin's got this one. We're 16 months.
Yeah,
right on the
great job, awesome job, man.
Nice.
Yeah, it's a lot of spacing, like you said, kind of between the teeth, top and bottom, and between the front teeth. But this was, believe it or not, with Invisalign as well.
Another Invisalign.
Yep. And you're right. Like usually you'd think this is a bracket case, no question, but Invisaligns can do it all.
That's awesome. All right, this next one. Okay, first glance at this next one, I'm probably thinking this one's a little bit easier to fix. I'm on the lower range of months on this one, man. I'm gonna go sub 10, less than 10 months.
Less than 10 months. All right, I'll go the over, then over 10 months.
Okay, this is a 15-month case. 15-month case, and the one tooth that was most complex to treat was that lower left incisor, that lateral incisor you can see on the bottom there. It's kind of tipped over.
Yeah.
If we looked from an aerial view, that thing was rotated almost 90 degrees.
Turned.
Yes.
Completely.
Yeah.
Was this Invisalign as well?
This was Invisalign too.
Wow.
Yep.
I find that shocking that you can do this much with something as easy as Invisalign.
Yeah. And that's about, to be honest, about 60, 70% of my cases are Invisalign. So I just love using it. I mean, the technology is so much fun, and I love tackling these cases because it's a challenge. It's fun.
Is this the last one here?
Oh, we got a bunch more, but whatever we have time for it.
Well, we can keep looking. I'm also curious because you've also talked about the 3D printing style. Is it braces? Do you 3D print braces, or what is it you're 3D printing?
Yeah, we're 3D printing the brackets with light force braces. And I actually have a case, I think 2 from now, that will be with those brackets.
Okay,
you can see how cool that would be if we got time. I'd love to show you that.
Let's jump to that one. Let's go 2 over. Let's go to the one with the
3D printer.
I want to see the 3D printer. One more over, Bill. Yeah,
there
that one
you
right
go.
Here. Yeah.
Perfect. So this one was with light force braces. This was a kid first time being treated.
Yeah.
How long do you think this took?
With the light force braces, see, I'm going to assume that the light force braces take less time than Invisalign.
Okay.
That's what I was assuming, because you're grabbing more things, shifting them around. I'm going to say this was 14 months.
Yeah, somewhere around there, like 13, 14 months.
Yep, good guess. This is 12 months.
Yeah.
Believe it or not.
Lower. I knew I should have. Yeah. I looked at Mames and she said, no, don't go lower.
You're getting the theme. No, because that's the thing. This would be easy, 18, probably closer to 24 months with traditional braces. Light Force cuts it down to 12. I mean, it's just so impressive that we don't have to take those braces off, reposition them, bend the wire. It just cuts all that out. So it's more efficient. We're moving teeth smarter.
So do you have those conversations with people too about like, here's where my teeth are, here's kind of my habits? Because you've said before, like, if you're not going to have the discipline to wear the Invisalign, don't do it, because that I would just forget it. I'd leave it on my lunch tray, something like that.
Right. I can do everything I can to make the case as predictable as possible, and that's what I do with Invisalign, but it does come down to ultimately how well you're going to wear them. If they commit to that, then we're good. We're getting those results that you see on screen. All those patients did an amazing job. But otherwise, then braces are the option to get you there, respective of not of wearing them.
I like that Clearsmile has all of the options. I think that's what's important too, because not every mouth, I'm sure every mouth is different, right? It's like kind of like every snowflake, right? It's that kind of style.
Exactly. Yeah. Everybody's got different teeth, we kind of view it like a fingerprint. Like everybody's got different fingerprints, has unique teeth. So that's where the Light Force pieces are cool too, because we 3D print them custom for those teeth, for her teeth. Those braces wouldn't fit on anybody else's teeth. So.
And you can get real results. We're seeing here, these are real patients, real results that you can get. And it's as easy as going by Clearsmile in Huntersville. You can stop by Burkdale Inn and set up an appointment with Dr. Gross and the team there. Multiple locations for Clearsmile as well. Clearsmile Charlotte clearsmileorthodontics.com. Again, in Huntersville, Birkdale Landing. Go by and see Dr. Gross. Thanks for coming by and hanging with us.
Congratulations again.
Thank you so much. Awesome. Hey, guys, wait. Prizes. Little clear smile tumblers here.
Yeah.
Get you guys
Thank you. Look at that.
Love it.
All right, Patrick Reynolds and Joe Berg up next. Joe Berg's last day. We've got somebody whose last day today, Dr. Gross. So
very nice.
You a big sports fan?
I am.
Okay, we'll talk sports.
That sounds
good.
My favorite.
Next time I'm on.